Hi, I'm Jean Sarnowski, and I'll be your host today for our 5th installment of Cape Cod Health News, a health information TV program brought to you by Cape Cod Healthcare. In today's program, we're devoting the entire show to focus on the VNA Hospice program. Hospice services were created to provide compassionate care and support to patients and families facing a terminal illness. We often hear from our patients and their families how much they've learned about the process of death and dying. We hope to bring you some valuable information about that time we're all heading for eventually, the end of life, that last bend in the road, a time to be comforted and to comfort, the most seriously personal experience every family must go through.
When I first heard the word hospice, I said, I don't think I want that.
We do a lot of teaching with patients and families about what hospice means.
I would say it took probably 3 months for my mom to feel comfortable with the concept of hospice.
I think a lot of people feel like, you know, if you get admitted to a hospice program, it means you're actively dying and you have days or weeks to live. And what we know is that that's not always true. And
hospice is a service of individuals in the community helping patients be cared for during their final road in life.
There's this nurse at the hospital. She came into the room and she says, "Are you going for hospice?" And I said, "I don't know. I really don't think so." And she said, "Yes, you do. You want that." And I said, "Why?" And she said, "Because it'll give you time with your husband."
Patients and individuals want to be cared for in the home, not in a facility. And since the 1980s, the vast majority of patients have been cared for at home, and that is the goal.
If I had to say one thing about hospice that I think people don't understand is that it is not for the last hours of living, or only for the last hours of living. It's certainly that, but it's so much more than that. It's for the last perhaps many months.
Everyone needs to come to the decision to elect hospice on their own terms. You can't follow a flow sheet. There's no script. Everyone's journey comes to an end in a different manner.
You know, sometimes statistics can show that people actually live longer on hospice because their needs are met, they're comfortable, they're where they want to be, they're with the people that they love, their quality of life is improved, and they really have better outcomes.
And when that person and that person alone elects to say, okay, I've had enough, I'm ready to elect hospice, that's when it's appropriate to have the conversation. We all, as human beings, have the right to care for ourselves in however way we see fit. And when we no longer want to fight the good fight, then it's time to have a conversation about hospice.
VNA Hospice was able to develop a relationship with my mom that they could slowly get her to talk about things, what her fears were, what her desires were, you know, after she passed, and what her desires were when she was passing.
So throughout Dawn's care, we also had Sarah, who's a social worker with VNA, was coming and spending time with Dawn, helping her to meet some last wishes that she wanted, and helping us as a family to adjust.
When VNA Hospice came on, they obviously have been through this before with so many people that they know what to look for, they know what to prepare for.
The first thing they ask me is, do you want him to be here or at home when he passes? And I said home. Then returned and asked Larry, and he says, definitely home. And we were home in 5 hours.
The largest piece of the puzzle is trying to get everyone to accept the decision that that person has made. And that's really key to hospice care.
I rushed home, and within the 4-hour limit that I had, they were here with a hospital bed, all set up, trays, everything, preparations for oxygen or whatever he might need came that day. And I was just blown away by that. It was so quick.
It's the wish of the dying person that comes first. And all of us need to come together and to try to figure out a plan that works for not only the patient, but it also explains the decision why that person has elected hospice.
And so we decided to move Dawn to our house here in Barnstable, which is the house she grew up in. And so the VNA arranged for the hospital bed to come to our home, and they set it up in our family room, which was the center of our house, and we wanted Dawn there so when people came to visit or when people were in the house, we weren't having her in a corner, but we had her where everyone could visit with her and spend time with her.
VNA Hospice was really, became who I was able to lean on, where before it was just me running in circles, not knowing what I was going to be doing.
And if you can transition at home with your family around, I mean, we had such amazing times of family time. Just, we had hymn sings around Dawn's bed with up to 20 people here just singing and praying together, and it was just amazing. And those memories are so precious that, you know, our neighbors were here, our friends and Dawn's friends and her pastor, and so it was a really special time.
I'd like to take a moment to thank those family members we're featuring in this show. Each volunteered to share their story with us, and we hope you can better understand hospice from their experience. When we return, we'll be talking about the vital role volunteers play in the day-to-day service of hospice care.
Hi, I'm standing at the Salt Ponds Visitor Center, the entrance of the Cape Cod National Seashore. 40 miles of pristine sandy beaches, marshes, ponds, and uplands support a wide variety of life. Lighthouses, cultural landscapes, and wild cranberry bogs offer a glimpse of Cape Cod's past and continuing ways of life. Swimming beaches and walking and biking trails beckon today's visitors. Even out here on the outer Cape, as far as the eye can see, the Visiting Nurse Association of Cape Cod supports a wide variety of home care and hospice patients from Provincetown to Plymouth.
At Cape Cod Healthcare, we all love our jobs.
We are always here when you need us.
24/7.
There are 88 locations
Across the Cape.
It's not just because of our cutting-edge technology.
Or the latest diagnostic tools.
We work in state-of-the-art facilities.
We have superior outcomes that bring you greater value.
Sure, all those things are great.
But the real reason we love our jobs
is because our patients are also our neighbors.
We are
Cape Cod Healthcare.
I'm standing on top of Scargill Tower, one of the tallest hills and structures on Cape Cod. The tower began as a tourist observatory in 1874. And from the top of Scargill Tower, you have an 80-mile view around Cape Cod Bay from Plymouth to Provincetown. It is from this vantage point that you can also see the greater service area of the Visiting Nurse Association of Cape Cod, who provides home care and hospice to the residents of this vast region.
Welcome back. Hospice care in the U.S. was founded by volunteers. Volunteers at VNA Hospice are a part of the team of nurses and aides who provide comfort and support to terminally ill patients and their families. They also contribute by offering holistic services as well as clerical and administrative support to the hospice team. Medicare regulations require that 5% of patient care hours must be provided by trained volunteers as part of the services they provide. VNA Hospice offers a variety of volunteer services rarely available through other agencies, and we are so very grateful to them for sharing their gifts.
Just yesterday, I was in touch with my volunteer coordinator. I had a patient who didn't have a lot of family around her. She was feeling lonely, she was afraid.
Our hospice department has about 40 active volunteers. A lot of them go away for the winter because a lot of these volunteers are retired people.
I had a volunteer named Dottie, who was marvelous. She would come and sit with him every Friday and let me get out and just scream if I wanted to, run to the beach or go get groceries or whatever during that time.
To sit with her and just make sure she's not feeling anxious and that she's got someone to talk to through the end of her life.
If they just want a little bit of company, maybe someone that we try to match up a volunteer that has the same likes and hobbies as the patient.
And the volunteers are some of the most effective, sought after, and meaningful people we have in the organization.
Some of our volunteers do pet therapy, some do Reiki treatments, which are wonderful.
The volunteer coordinator, Kathy, has picked us to go to patients that would benefit. So we really appreciate that. We know we're wanted, we know Angus is going to have fun with the patient and the patient is going to enjoy seeing Angus. So it's a win-win-win.
When you're an animal lover your whole life. And a lot of these people, are elderly and they haven't been able to have a pet in a while, so they light up. There's something about a little dog coming to visit. And I think there's even studies on what it does to, bring your blood pressure down and calm you. Reiki is more of a calming. It's almost like it is like a calming. I don't want to say massage because it's really not a hands-on, but it's just a relaxing, calming environment for the patient.
The first Reiki treatment I gave to him, I just put my hands on his head because he was sitting in a wheelchair, and I personally could feel him releasing all his anger, of having cancer. He had a lovely family and he just didn't want to leave.
We have volunteers where they can come and sit and give the caregiver a chance to go to the beach, go to the grocery. They can record their stories.
This is an amazing opportunity for volunteers. A lot of people ask, why do you do this work? Isn't it sad? Isn't it hard? Isn't it difficult? Don't you grieve? I do grieve. But the reality is to have the opportunity to companion someone through the end of their life is such a gift to the person who's there.
They come in and they allow the caregiver to go out for an hour or two a couple of times a week and get a few basic errands done. They sit with the person. They allow that person another face. Maybe they have a conversation that they don't feel comfortable having with a family member. It's one of the most meaningful things that you can do as a volunteer for any organization.
It's so rewarding to feel like, okay, I really made a difference in the life of this person as they were going to the next place. We all have all sorts of emotions and fears and worries and sometimes just comfort and acceptance, but to have someone there to hold your hand, to have someone there just to reassure you, to listen to your story, you get the opportunity to leave your legacy and have somebody to hear that and witness your story.
We do Life Story, which is actually a recording. There's like a prompt out, bunch of questions that the volunteer will ask, and then they do it on a little recorder, bring it back to me, and I make a little CD, and we bring it back out to the family. So we do a lot of that. And there's a lot of respite for the caregiver because really there's a big burden. It's a tough thing. It's a hard part of life, but the caregiver needs it more than they think they do sometimes.
Some folks just need a companion. Some folks need a ride to doctor's appointments. They need rides to go and see a family member or to experience something that's going to give them a better quality of life. And having a volunteer available to do that relieves the multidisciplinary team of things that we have a different focus. And so the volunteers can really spend that quality time with a patient.
If you are interested in volunteering for VNA Hospice or just the VNA of Cape Cod, fill out the volunteer application form under the Volunteer tab at vnacapecod.org. After the break, we will take a look at what each person needs to do to ensure your final wishes are known and agreed upon with your family.
The Cape Cod Canal behind me has been shaving 135 miles off the journey for boaters heading around the Cape for its approximately 14,000 annual users since it opened in 1914. 2 years after construction of the canal, the Visiting Nurse Association was started in Falmouth. Today, we have grown to more than 850 employees, providing more than 300,000 home visits annually. Most of our services are available 24 hours a day, 7 days a week.
I
I know you'd rather be anywhere instead of here. I know you'd rather be in your own home.
In your own bed.
But while you are here, I'm going to provide quality, compassionate health care. To our neighbors and visitors,
We are the community safety net.
we are dedicated to you and your community.
Even if you don't love being here,
We'll be here for you.
we'll be here when you need us.
We're going to take good care of you.
We
are Cape Cod Healthcare.
I'm at Grays Beach in Yarmouth Port on the boardwalk that extends over the salt marsh and offers an excellent view of coastal plant and marine life. The salt marsh behind me is teeming with all kinds of marine life exposed every 12 hours as the tides change. The constant rhythm of the tides provides stability for the marine life who live here. In the same way, the residents who live here on Cape Cod can also count on the stability and continuity of care in the home through the VNA of Cape Cod, a member of Cape Cod Healthcare.
You've had discussions with your healthcare providers and the hospice team and decided to choose hospice care. If you haven't already, which is not unusual, it's time to document your wishes for your immediate future. Advance directives are critical. The VNA's team of social workers and care managers will help you take care of these. This is not only for your benefit, but it is a gift to your family and caregivers.
We never want to be feeling as though we are doing anything other than helping our patients. And if we feel that we're doing something that the patient might not want us to do, it really doesn't make us feel good about what we're doing.
We have a lot of technology that we've developed over the years that allows us to prolong life, but oftentimes in an unmeaningful way. And what we want to do is initiate conversations before the end of life so that people can have appropriate care that's directed according to their philosophy and wishes.
These patients are much more susceptible to the consequences of hospitalization instead of staying in their home. And in fact, the medical evidence supports in many cases that patients do better when they're treated at home in their home environment, especially as they develop syndromes such as geriatric frailty syndrome, or whether it's because they want to be there or not. Families do better, patients do better, outcomes are improved.
We are expending too much time, too much energy, prolonging people's lives in a harmful way and not listening to what their concerns are, their wishes are, and not allowing them to have control over their own fate.
I think one of the bigger challenges is that we live a long time with chronic illness, and our culture is not well prepared to manage that part of the completion of life. And I mean specifically not only the medical implications, but also the social support systems that are required to keep people in their preferred environment. So that includes caregivers, financial concerns, community support, faith communities, and then our medical community as well.
We can make a decision whether or not surgery plays a role as long as the wishes are well defined. Patients in that situation need a healthcare proxy. They cannot make decisions for themselves.
It really is important that everybody who's 18 or older have a healthcare proxy in place and have an agent who understands what it is that's important to them.
The importance with the MOLST form or the DNR form is that when people come in, especially if they are at the end of their disease process, what they don't understand is that a CPR can be really damaging. It cracks ribs, people can be living off of machines when that's not what they really want.
We have our social workers who are an integral part, just for the advanced care planning aspect of it and the coping and helping families with end-of-life decisions.
So we do a lot of teaching around, how we can help this journey be more comfortable for you, how we can make sure that your wishes are honored, that we do a lot with advanced directives, making sure that we know your wishes and what's important to you and work as a team together with you and with your family and with the other members of the multidisciplinary team to make sure your wishes are honored.
We have a book that we go over which is called The 5 Wishes, and it takes everybody through different plannings for end of life that they might be more ready to talk to a social worker or a nurse than talk to the family. and things are written down, and then we can all come as a discussion. These are his wishes. So it's down in black and white, and there's no thinking that he wanted this or he didn't want that.
Anyone who comes in contact with the elderly and would be a good person to start that discussion of what are your wishes? What have you thought about? What have you discussed with your children? Are your children aware of what's important to you? Have you thought about what's important to you? And what kind of quality that you would like, what your choices would be for quality as you are approaching the end of your life, or as you are managing a chronic illness that could significantly impact your quality of life.
When we return, we'll discuss the relationship the VNA of Cape Cod Hospice has with Cape Cod Healthcare.
I am standing in front of Woods Hole Oceanographic Institute. Ships operated by WHOI carry research scientists throughout the world's oceans. Scientists from WHOI are constantly monitoring the health of our oceans throughout the world. The Visiting Nurses Association of Cape Cod Caregivers also travels the length of the Cape from Provincetown to Plymouth, Martha's Vineyard, and Nantucket, constantly monitoring the home health needs of Cape Cod residents.
At Cape Cod Healthcare, we're a team.
In every one of our 88 locations across the Cape,
you'll find people to care for you 24/7.
There are nearly 5,000 healthcare professionals
dedicated to you
and your community.
From Bourne to Provincetown,
Falmouth or Hyannis.
You'll have access to great care
wherever you are, whenever you need it.
Because we're not just a team, we're Cape Cod's home team.
We
are Cape Cod Healthcare.
I'm standing in front of Cape Cod Hospital in Hyannis. This hospital is part of Cape Cod Healthcare, with more than 450 physicians, 5,300 employees, and 1,100 volunteers. Cape Cod Healthcare includes 2 acute care hospitals, 4 urgent care centers, a skilled nursing facility, an assisted living, and a variety of other health programs. It also includes the Cape's leading provider of home care and hospice services, the VNA of Cape Cod, caring for you and your family for more than 100 years.
You've had your babies at Cape Cod Hospital, your appendix was removed at Falmouth Hospital, your knee was replaced by a Cape Cod orthopedic surgeon. Your parents recovered from surgery at home under the watchful talents of a VNA home care nurse. You can benefit from the services of Cape Cod Healthcare System. Even at the end of life, when critical decisions are made for your health and safety, VNA Hospice is there with the full backing of the services of a greater system. Why would you switch to another agency now?
The wonderful thing about the Visiting Nurse Association, the Palliative and Hospice Program, is that it is a part of Cape Cod Healthcare, and it is a part of the regular VNA services. It's just following the continuum of care. So while it is a separate group of VNA nurses, you're staying with the same organization, we all use the same programs, and we work so closely together among the different teams of VNA nurses so that we are all kept up to speed for exactly what's going on so that the patient is getting that continuity of care throughout.
I'd say one of the first things for people is that they don't have to change physicians. If they stay within the Cape Cod Healthcare System, which of course we are part of, that they can keep their physicians. So that means a lot to a lot of people, that they stay with their primary care physician. They're not required to take on a medical director someone they've never met before.
Since we are hooked up with the hospital, we're able to go in and access the records so that we can see what care they've had, what treatment they're undergoing.
I see patients that have come into the hospital who are already on service with us, so palliative care and hospice patients already on service with us. I follow them once they get here. I also take new referrals from the physicians, someone that they think is appropriate for palliative care or hospice, and I screen them.
And we've been in touch with these physicians over the patient's, diagnosis before hospice, so they're aware of us, they trust us, and we have the accurate and most important information on the patient's care.
It's almost like a more streamlined version when you come to the VNA hospice, because you're already in the system. The doctors can freely share the information back and forth,
And that they also have all the resources of Cape Cod Healthcare. They've got, all that we have to offer, from physical therapists, occupational therapists, speech therapy, whatever it is. We have the whole gamut here under one umbrella, as it were. So that means a lot to people, especially when they're transitioning from palliative care to hospice, because then they get to have the same staff. They have the same nurses, the same home health aides, therapists that they've had in the home. They get to be the same personnel, and that means a lot because it's all about trust. They've gotten to trust those people.
What's often important to them is being able to return to their family, to spend time with grandchildren, to see the birth of a grandchild or a great-grandchild, or to see a loved one graduate from high school or college.
At each hospital on Cape Cod, there's a hospice liaison that can help answer any questions, just consult, we're here.
That hospice is not just for last hours of living. It's really for, as one approaches end of life, a focus on goals for the best quality that they can have.
When the doctors and the nurses start talking hospice to me, and I'm 20 years younger than my mom, it scared me. Somehow the word needs to get out that hospice is a caring thing, not a scary thing.
The main thing hospice does for you is it gives you time with your loved one. It gives you time to breathe, it gives you time to cry, it gives you time to get ready for the inevitable. And believe me, there's nothing like hospice. There's nothing like VNA. And it's wonderful people. They must choose from God's people, because everyone who came in here had the perfect attitude, the perfect smile, the perfect words, everything I needed to hear, everything I needed to see. And they made me laugh. They made Larry laugh.
Well, that's about all we have time for today. Thank you for tuning in, and remember, if you would like to become a hospice volunteer, please contact the VNA of Cape Cod at 508-957-7709 or go to our website, vnacapecod.org, and click on the Volunteer tab. I'm Jean Sarnowski, wishing you good health and good health care.